Good afternoon, everybody, and welcome to the workshop of the Board of County Commissioners. Would you all please rise for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Right, first up, we have an update from Joe Theine and Southwest Health Systems update. All right, well, welcome, Joe, and we're ready to rock and roll.
Awesome. Well, thanks as always for the opportunity to share with you some things, and if you have questions, stop me, interrupt. I'll just try and give you some highlights of how we started the year. Travis, if you want to go ahead. Cover a couple things today, just real high level on how we're doing from an operational status. The short answer is pretty well at the moment. Talk about some of our focus in longer term planning, and then I'll wrap up by sharing with you we're not planning to make any changes to Medicare Advantage in our relationship with those payers, but I'll highlight that at the end. So go ahead. So similar to what I've shared with you over the last year, kind of how we plan for growth in the hospital, and then how we're doing so far. So this is our plan for 2024 compared to the first 2 quarters of the year. And what you'll see is in most areas of the hospital, we plan for some growth. Like you, we do our planning in the before the end of the year. So we did ours like late summer, early fall, and we actually had a busier end of the year than we were forecasting, which was good. So we didn't actually plan for decreases in births or rural health visits. It's just that by the time we ended the year and had the year-to-date totals, it was actually higher than where we thought. I think the good news you'll see across the board is at the start of the year, the first 2 months, in almost every area of the hospital, we're seeing an increase in use of the hospital and services even beyond what we planned for, and certainly is reflecting in what we expect to collect in cash, and is going to help us start to fund some capital purchases and other things this year. Questions on any particular service? Or
I actually do. I'm looking at the 2 highest at the very end, your sleep studies, which that's kind of a day in, day out. The sleep study goes home with them typically, or is that in-house at the hospital sleep studies?
So what we're measuring here is in-house sleep studies, where someone will come in the afternoon, they'll spend the night actually in a room, have that sleep study conducted, and then go home the next morning.
Okay, and then the next one too at the clinic. Specialty visits, is that in-house, or that's just a visit to the
So that's a visit to one of the specialty physicians in the clinic, not admitted in the hospital.
Right,
Yep.
right. And the rest of them seem pretty, I mean, if they averaged out, what would you say they are, 4%?
The place that's kind of a summary number is in the middle. It says patient days adjusted.
Mm-hmm.
In the hospitals, that's a measure of kind of all the activity kind of wrapped into one number. And so you'll see there we plan for a 4% growth for the whole year, and at least in the first 2 months of the year compared to the first 2 months of last year, it's a 12% growth. So that's kind of the one number that lumps all the activity together. Yep.
Okay, good.
Good questions. Been sharing with you how we're doing on employee retention, and as we finished up the end of last year and are going into this year, have continued to see increases in our employee retention. I don't think I have it on a slide, but we finished last year on the nursing side with about 90% retention rate over the year, which is tremendous. We wouldn't expect that to hold forever and then some, but certainly a good place to be last year. And then again, you can see here overall, over the last 12 months, we're just under 80% retention for our staff, and it's generally been on a positive trend.
Good.
Shared this with you last time we met in December. We expect to collect about $85 million in total, and have been sharing the important role that Medicaid plays in our hospital. So when we just look at the fees we collect for the direct services, about 17% of what we expect to collect will come from Medicaid. If you add to that a program where hospitals pay in a fee, and that's matched federally and returned to the state to distribute to providers, when you add that back in, it's a total of $20.5 million that we expect to collect from Medicaid, which is almost 24% of our revenues this year. And certainly have been sharing that with a lot of our elected and appointed officials, I'll note Congressman Hurd, who I know is going to be here tomorrow. He joined on with several other Republican congressmen, wrote to the leadership in the House expressing his support for the Medicaid program in rural communities, especially to make sure that those that the program's intended to serve continue to have access to care, and that we lessen the likelihood of closing services in rural communities. So appreciate the work you do with our elected officials, especially Congressman Hurd. He's been doing a great job of listening and trying to understand how to support our hospital and rural hospitals in general.
So on that, because I'm sure we'll get more questions on this later on, but specifically this evening.
Yeah.
But has it affected our hospital at all? I mean, and if it has, to what degree or a percentage? I don't know if you can put that,
Yeah.
if you can quantify that or not.
It's a good question, since at a federal level, the Congress passed a continuing resolution that carries through till September, and that continuing resolution left the funding largely intact. So we haven't seen any changes yet. We continue to monitor and be concerned that Energy and Commerce in the House has a target to cut $880 billion from their funding pot over 10 years, and it's really hard to see if they carry through with that amount of cuts, how they would do it without affecting health care. The large majority of that committee's funding is either in Medicare or Medicaid. If you took all the other funding that's not Medicare and Medicaid and Energy and Commerce, and you cut all of it, you would still have to cut health care. It's just that, it's hard to imagine that they'll continue down that road with that large of a cut without impacting health care. And so I think, as the Senate and the House come together and try and reconcile their spending priorities, we'll see where that lands. And, again, was glad to see Congressman Hurd write to his leadership in the House expressing his concern around cutting Medicaid.
Okay.
At a state level, so again, Medicaid is, a shared responsibility between the state and the federal government. At least what made its way out of the JBC, Joint Budget Committee, and I think is likely going to continue, was no cuts to the provider fee program, where hospitals pay in fees and then that gets matched at a federal level, which there was some concern that the Joint Budget Committee would take money from that intended use and put it back into the general fund. That didn't happen. And then they included a pretty modest increase in Medicaid payments to providers in their budget as 1.6%. We're seeing the cost of operating hospitals in Colorado going up about 6% per year. So even with a small increase in Medicaid provider fees, it doesn't absorb all of the cost of inflation and what it's costing us to operate. But again, we were really nervous that the state would be making cuts even in advance of the federal government, and it doesn't appear that that's going to happen.
So would you say they added 1.7?
1.6%.
1.6%.
Yep.
Okay. Very good.
Thanks. Go ahead, Travis. Here's how we expect to use funds this year. You can see most of it's for operations. Every day we open our door, it costs us about $211,000 to operate. Take that times 365 and you get roughly $78 million. I think the piece to look at here that's different from last year, and I mentioned, is what we're planning to do on the capital equipment side. This is not including the infrastructure fund when we re-amortized our debt that helped pay for the roof last year. We're doing some HVAC upgrades this year. So that building infrastructure fund, is funded elsewhere, not through operations at the moment. Last year we spent under $100,000 of our own money on capital equipment, so anything other than the building. This year we have planned $1.25 million, and that's as a result of some good operations last year, how we finished the year, and how we think we're going to operate this year. So it's really good to be investing back into the hospital and the equipment that people need to do their jobs well. We still have, at the present time, about $3 to $4 million worth of capital needs, so we're just starting to put a dent in that this year. But certainly we have a long ways to go to replace the equipment in the hospital in a timely way. Here's how we're sitting with days cash on hand. So in total, 103. The piece that we think about with our bondholders is making sure that we have at least 60 days of cash in the bank now. and you can see that we have 80 days that's not a part of that restricted money for the infrastructure or that we need to have for a bond debt reserve. And again, as we're looking out and thinking about our ability to use that money, some of that's going to be on equipment this year. We also were starting to merge our electronic health record systems. We have one in the hospital, one in the clinic, and for a number of years there's been a plan to bring those all onto the same record system, but we've not been in the financial position to do that. Late last year and early this year, we started planning with the physician and provider leaders to see if that was an important thing to be done in the upcoming year, and the direction we got from the physicians and providers is yes, they want to see that merged. So either later this year or sometime next year, we'll be combining those systems, and we've kind of saved the cash to be able to make that change when the time's right for us as well. So while we're increasing cash in the bank, it's not just sitting there collecting interest. We actually do have some intended uses both on the capital equipment and on the IT infrastructure side of the organization, but sitting in a really healthy place relative to where we've been in terms of cash. Go ahead to the next slide, Travis. So we'll talk a little bit about the work our board did. I believe I shared with you at the end of last year that our board approved some objectives. They really fall into two broad buckets. So one is if you live in the communities we serve, part of our job is to make sure you can live the healthiest life that you can. And the other is if you live here or travel through for any reason, that you have access to urgent and emergent services. And so I'll touch on a couple of those, the things we're doing this year and how we're thinking about that. Go ahead. So the first thing we looked at is how do we think about improving health for people? And there's, for 15 or more years, county health rankings and roadmaps is published for all of the counties. In a lot of cases, they can get down to a zip code level, how counties compare and their overall health of the population. And it takes into account a variety of things, including the burden of chronic disease, economics, other things. And you can see Dolores and Montezuma counties both fall below national or state average when using that county ranking system. It's something that we're sharing with our board so that over multiple years we can think about how our community's health is changing and hopefully improving. It's not something that we can use to kind of measure our day-to-day activities to know what our impact is. So it's something we'll look at periodically. It's usually updated annually. This is the most recent update that came out earlier this year.
So,
Travis, go ahead.
I have to ask this question here.
Yeah.
Because I'm looking at both counties, Dolores and Montezuma County, which are both trending below the national and state average.
Yep.
But is that because we're all, both of us, an aging community? Obviously with age comes more or tentative health issues, but is that?
There, without going through all the factors that are in there, generally age comes with less health, but there's also other factors. People with lower incomes generally also have lower health status. May not be causation, but there's correlation. Our income levels in both counties are lower than the national and state average as well. The distance one has to travel for things, can also be a burden in terms of accessing preventative care or health care. So there's a variety of factors that go into that.
Yeah.
Yep.
Be interesting to look at that whole survey to see why, because.
And some of those are within the influence of the healthcare delivery system. Some of those are outside the influence of the healthcare delivery system, for sure. So these are the three large areas where we're putting some intention around. The people we employ, the service they provide, leading to safe and high quality care. And if we have great people doing great work, we expect to grow. And you can see there's some areas that we intend to make a difference in all three of those buckets. I won't go through all of it today, but I'll highlight a couple of things in a few areas to give you some examples of what we're doing. And you can go ahead and go to the next slide. So the first thing we'll touch on is the importance of people in an organization. The slide that's up here is something I've shared internally with our staff and providers and our board around the importance of focusing on the people in the organization. So often when times are lean, one of the... Sorry, no worries. that better? Great. So often when times are lean, we can decrease our investment in the people doing the work. And many years ago, a group got together and published some work in the Harvard Business Review. And their goal was to make the case to the finance people that there's actually a positive financial return on investing in people when it's done well. And the concept that they put forward has become well known as the service profit chain. And it really starts with the idea that when you make the right investments in creating the right work environment for people, that a series of positive, virtuous cycles will occur that can lead to your customer being served well. And it's kind of oversimplifying, but I think if we've got an 18-year-old son at home, and if I ask him to do the dishes and he's had a great day, he's generally pretty cheerful and, doesn't make a big fuss and the dishes get done. If he's had a bad day for whatever reason and we ask him just as politely as we can to do the dishes, we might get a little bit of a different response. And in our workplace, especially in a hospital, having people showing up and having the conditions under which they can do their best work is really important. And we know when that happens, it leads to great care and it leads to people leaving, recommending the hospital to their friends and family members. And so our investment in people is starting to become very intentional for that reason. Go ahead. So some areas where we're focusing on, one is around concepts moving us towards becoming what's known as a high reliability organization. And so if you think about it, most of the time when we get on an airplane, we don't think about whether it's going to land safely or not. We expect that to happen. And there's a number of things that occur in order to ensure that. The pilot may get out and, the pilot gets out and goes through their pre-flight check and everything else. We do the same thing in an operating room and a lot of other settings in healthcare. And we're starting to teach those things throughout the organization. So the whiteboard that's highlighted with all the sticky notes, that's actually sitting up in our diagnostic imaging area. And I'll share with you the example of when we empower our staff to make improvements in their department without needing other people's intervention, great things can happen. So our DI scheduling team had a particular office that is not a physician's office that we employ, where patients were often complaining that their physician would send an order to us for an image and we wouldn't have it or be calling the patient back to schedule that. And so our staff started doing some process improvement work. They were trying to figure out what are all the things that we're doing and how might the patient be having this experience. They got far enough along in their work that eventually they picked up the phone because we couldn't find anything internally. So they picked up the phone, called the other physician's office and said, hey, when you have a few minutes, do you mind just walking through the steps that you follow when you send us an order for an image, X-ray, CT, MRI, whatever? And so the other office said, sure, we'll do that. And they literally started walking through the steps in parallel of what their office did and what we were seeing on our end. And what happened was the referring office was putting all the information in their system, and when they got to this button that said send the order, they would hit the button and our staff would say nothing's happening on our end. So they'd hit the button again and nothing would happen. So all of a sudden the staff on the other side said, gosh, we need to find out why nothing's happening when we hit this button. And it turned out that the way they were sending us orders, we were the only office that they sent them that way, and their system never turned on that button. So the office thought that they were sending it, the patient thought we were receiving it, we never got anything, and we were wondering why they weren't sending it. And none of the leadership in the hospital was involved in that. It was teaching the staff how to be methodical about looking at a process, not blaming somebody else, but just taking the steps to improve a process. So when they figured out that the button wasn't turned on, the staff at the other office said, well, this is really easy for us. We have a fax machine right next to our computer. We'll just print it off, drop it on the fax, program your number in, and so all of a sudden we start getting the orders. And it's a great example of the type of investment we're making in teaching our staff to not blame somebody else when something isn't working right, but to really start looking at the process, what are the steps, and how do we improve that. Go ahead to the next slide. We were talking earlier about the county health rankings, and that's something that's hard to measure. There's a lot of things that go into that. So we've started to look at proxies. What are the things that we have more influence on that we believe will help people improve their health? And one of the areas of focus strategically you saw was increasing people's access to primary care. So we started looking at not just the number of visits to a primary care provider, but how many patients are receiving care over a certain period of time in our walls. And again, we worked with the physicians and the medical staff to come up with a method by which we can look and say, is it reasonable to believe that an individual person is underneath our care within our primary care practices? And so what you're seeing in the slide here is the number of patients that we believe are attributed to our primary care practices over time. And this is one of the ways that we believe we can start to measure our impact on improving people's health by making sure that patients or people who live in the community have access to primary care. We know we're not the only primary care provider in the community, so we wouldn't expect 100% of people to have a primary care physician with us, but we would expect that number to grow over time. And what you can see through 2023 and 2024 is that number was actually decreasing, and then late last year and early this year it started increasing. I just saw the March numbers, and they're up again from February. And so that's an important part of how we want to be improving people's care. Go ahead, Travis. The other place where we're being really intentional is when somebody does need access to emergency care, how do we appropriately take care of people in our walls and not have to transfer them out for things that we could be doing? And so a couple of measures when we're thinking about, do patients have access to urgent and emergent services? One is that when somebody presents to our emergency room, they shouldn't leave without being treated. If someone's presented, presumably they're there for a good reason, and we want to make sure they stay and get care. There's a national standard for a variety of reasons patients may leave after initially presenting to the emergency room, but there's a national standard that's to have that rate of people leaving be less than 2%. And what you can see here is the line that goes across is that percentage for our hospital, and it's very consistently well below that 2% in the last 12 months or more, with the exception of 1 month, and in most cases it's half of that national standard. So this is one way we think about, do people have access to emergency care? Go ahead, Travis. The second way we think about it is once somebody presents to the emergency room, and if they're not going to be going home, they need to be either admitted to our hospital or they need to be transferred to a higher level of care. What happens, and are we taking care of people in our hospital that we can? Or if not, are there things over time that we could be doing differently, whether it's staff training, equipment, additional staff resources that will help more people get care in our hospital when they need it rather than having to go somewhere else? And so this looks at admission rates and transfer rates. And when we, about 6 or 8 months ago, started our planning, we looked at some national averages for rural hospitals, not urban. And what we saw at that time was our hospital was on the low end for admissions of normal and the high end for transfers. They weren't outside of what's considered normal, but they were kind of at the very fringes of that. And so it caused us to start asking ourselves, what might we need to do differently to be more like an average rural community and or keep more people closer to home? What's interesting was we haven't done anything yet. All we did was start doing chart reviews in the late fall to start gathering information to see, are there common patterns of why we transfer people, and are there things we might be able to do differently to help more of those people get care in our hospital? And one of a couple things may have happened this winter. Either the pattern of care needed was different than previous winters or other times in the year, or there's a commonly held view, it's called the Hawthorne effect, that when you start to study some things, people start changing their behavior as a result of studying it. And so that September-October timeframe is when we just started doing chart reviews on any patient that was transferred from our emergency room to another hospital for any reason, but we didn't change anything. And what we've seen over the last couple of months is that we're keeping more patients in our hospital and transferring fewer out. We're going to continue that good work and see if there are other things that we can do in the hospital, again, around equipment, staff training, so that fewer people have to leave to get care. Go ahead. The other area where we're looking at both how to improve people's health and then how to transition from an inpatient stay or an emergency room visit to primary care is through a nurse care coordination model. So we're partnering with an organization called the Community Care Alliance. It's a subsidiary of the Western Healthcare Alliance. They both have member hospitals all throughout Western Colorado. We're one, and we're choosing to purchase a service through that will embed nurses into our primary care clinic to do a couple of different things. As we're starting to roll this out, it'll be for Medicare patients that have Medicare Part A/B. There's a funding mechanism through Medicare that allows for that. And the couple areas that we'll be really focused on are for patients that have a number of chronic conditions, may have a pattern of utilizing a lot of healthcare services, or their health isn't well controlled. The physician and the patient will be able to enroll them in a nurse care coordination program, so that in between visits to the physician or the provider, they'll have a nurse that is following up with them on their care plan. If the patient has questions about a side effect for medication or a test result, they'll be able to work with that nurse to monitor and help coordinate their care in between visits. The second place that we'll be really focused on, again, for Medicare patients, if a patient's admitted to the hospital, when they're being discharged, that nurse will come alongside the patient for a period of time to make sure that they understand their care plan leaving the hospital, that care plan's followed, and they get transitioned back into a primary care office, and that transition is relatively seamless from the patient side, coordinating their discharge from the hospital back to primary care. And the way that we're doing this through the Community Care Alliance is not to have a nurse physically on site in the hospital. It's really easy to have a person in the walls where we're delivering care, and they can get distracted by all the day-to-day stuff, and kind of that care management can easily be put aside. So the nurses in the program will work virtually, and their focus will be on that chronic care management. The nurses live in rural Colorado, so they're not terribly distant. They're familiar with Colorado and rural communities. And it's a very intentional investment we're starting to make. Go ahead. The other place we're expanding is in Mancos. So this year we made a couple of commitments and have followed through on them. One was to start offering prenatal care in Mancos, and the other was to be open Monday through Friday. So prior to this year, for a number of years now, we've just had a provider Monday through Thursday. You can see in early January, we opened up our first Friday clinics, and aside from maybe a handful of vacations, we'll be open 5 days a week. And we took care of our first expecting mother in Mancos later in January. And a lot of that has been made possible through donations in the community. Our foundation raised the money last year to purchase the ultrasound equipment that's now sitting in the walls of the Mancos clinic. So really excited about offering that care for the community. Last slide, and then again, happy to answer questions. I think I shared with you sometime last year we were going to start taking a close look at our relationship with Medicare Advantage, the private side of Medicare. We over the last 2 years have estimated that we will collect about $2 million less from Medicare Advantage compared to what we would have collected from Medicare Part A and B for the exact same services. And more people, for good reasons, are choosing Medicare Advantage when you look at some of the things that they offer individual people. We took a really deep dive into each of the major Medicare Advantage plans that's available in Montezuma County. The long and the short of it is, right now, we don't think it's in the community's best interest or the hospital's best interest to end any of those agreements, but we have collected enough information that we'll be starting to go back to those plans and asking if they'll behave differently in the future, both towards patients and not delaying care, and also making sure that we get paid fairly for the work that we do. So we continue to be looking at this, but as you're thinking about your constituents and our communities, if someone's asking if we're planning on ending any Medicare Advantage contracts for next year, 2026, we're not. I think that's the last slide I have. And again, always happy to answer questions and appreciate the opportunity to provide you with updates.
I don't have any right now. Thank you, Joe. I appreciate it. I think I asked most of mine through the presentation.
Yeah.
I do have some notes for tonight, just in case we're asked. I can also reference this slide if you don't mind.
Not at all.
If we have to pull it up, but.
Yep. Feel free. And certainly, if you get some questions that you can't answer, feel free to reach out and let me know. And
I will.
You
I
don't
will
have to
send them
call
to
us.
you.
You can come.
But that's good. No changes to Medicare Advantage for
Correct.
2026 right now.
at least that we're intending to make. I can't speak for the payers. They'll do what they want, but on
Yeah.
our end, we're not intending to make any changes.
I mean, one of the biggest questions we get all the time is about Medicare,
Yeah.
you know, and people wondering if they were going to be funded or stripped or whatever. So maybe we can put some of that to rest tonight, so.
Yeah, and I've encouraged our elected officials at a federal level, if they're looking at where our tax dollars may not be well invested, Medicare Advantage, I think there's some opportunities, you know, at the federal program level to look at that program more closely rather than Medicaid. And I've shared that with Congressman Hurd, so
Yep.
he's well aware.
Good.
Yeah.
Any? Okay,
Well, thank you very much.
thank you
and
very much. Appreciate the update.
Appreciate it.
Good luck tonight.
Yep. Oh, yeah, it'll be good.
It's good just to sit down and speak with people.
Yeah, it's always a good thing. Well,
Yeah.
thanks again.
All right.
Appreciate all of you.
Thank you, Joe.
Thank you.
Yep, you too. All right, now we're going to talk about some fee schedules for the county, and today we have two of them. First one is the Fairgrounds. Justin McGuire, come on down.
Afternoon.
Good afternoon.
Okay, so what we got up there is a little comparison I kind of did between what we have at our fairgrounds compared to what some of the other fairgrounds are doing in our vicinity, or that we kind of, I guess for lack of better terms, compete with, although it's not really competition. But looking at our fees, the way they're set, we're pretty competitive and comparable to a lot of the other places that are around us. I don't think raising our fees at this current particular time would be in our best interest, and I can kind of go over a little bit of why. Right now we are getting some revenues from our fees, and those are running about, this last year they were $110,000 for the year. And then on top of that, we get our conservation trust fund money, and that was right around $213,000, I believe, for 2023. Into the future, so that's given us about $323,000 total between our revenues of what we receive and then also our conservation trust fund monies. Our expenditures at the moment for 2024 was $292,000. So that did put us $30,000 more, which gave us a little opportunity for capital improvements. Moving forward, the conservation trust fund money is going to be going up for 2025. So I'm expecting a 10% increase in that. And then our budget is basically staying the same for what we're expending. So I think our biggest thing is having more events and more things out there at the particular time, rather than trying to maybe increase our fees at this exact moment. I do kind of keep an eye on them, you know, to make sure we are where we need to be. And I think after 2025 is over, it'll give us a little bit more sense on exactly where we're sitting as far as what we're bringing in for our revenues and what we're actually going to be getting for conservation trust funds, and then our expenditures. So I mean, at this current time, that would just kind of be my recommendation or my thoughts, is to kind of move forward at this moment, sitting where we're at, and then maybe take a look at it a little bit further down the road as far as doing any increases. And then doing an increase across the board, like if we were to just do a percentage across the board, I don't know if that's quite a good thing for us to do. It might be just doing, you know, individual things later on. You know, just kind of the thoughts that I'm looking at it. But one thing I do notice that we have a problem with, and it's when we're trying to book the fairgrounds, is I do have a little bit of issue with, like, when I'm trying to do meeting room rentals. And that's one thing I kind of emailed Travis about. And when somebody has to go get a insurance policy to rent anything at the fairgrounds, it's costing them $300, and then they're only paying me $100 worth of meeting room rental. I don't know if the county would be willing to maybe try to do a waiver for any kind of meeting room rentals as far as insurance liabilities. The kitchen, you know, I can understand that. We should probably keep that on the kitchen just for the possibilities. But as far as our meeting room rentals, it might be something we could look at and not require, you know, them to give me a general commercial liability insurance for like a meeting room rental. And other than that, I think that's something that could help us a little bit out there as far as getting more interest and more things to happen. That's kind of where I'm sitting with everything at the moment.
So I guess to answer your question, Justin, that you just asked, I'll look to Stephen, because these were probably drawn up by the attorneys. All of these contracts have all been drawn up by the attorneys.
They were, yeah.
So, I mean, would that, I mean, I know that we're trying to limit our liability for anything, anywhere in the county, so is that even I'm not sure that's even a possibility, is it? I mean, would we waive that? I know what you're asking, but I'm not sure that legally, because then if something happens out there,
yeah.
then we're 100% liable.
I just know somebody can just drive into the fairgrounds anytime they want, and you know, if something happens out in the parking lot, is that different than, I guess, them renting a meeting space from us? You know, that I don't know, or is that risk any different?
Depends on how confrontational the meeting is. I mean, there could be all kinds of things that happen in that meeting room.
True.
Well,
I mean,
I guess the other aspect is we're requiring everybody else to have insurance, but we're waiving it for certain
yeah, that's,
programs. I mean, I think that's just,
I mean, some of it comes down to like, right. If you take kind of this blanket approach that sounds like we have been about, you know, requiring anyone who's renting this space in any way to have commercial liability insurance. I don't know if that's required by some of our insurance carriers. But what I'm hearing is a downside of that approach is that it makes it, you know, much more expensive for someone to come rent that space.
Exactly.
And from what I'm hearing from Justin is for something that maybe doesn't have that much risk in his opinion.
Exactly.
Of liability. So there's some weighing of you know how the board thinks about those different risks from my perspective. You know, if the board were interested in having more rentals of this type, maybe it's something we could spend some time looking at and seeing, you know, what kind of meetings are these? Like, it sounds like people just rent a room and talk to each other.
Yeah, it could be anything. I mean, we've had people interested in doing birthday parties out there, just for an example, you know. And the problem is that they want to go out there and do something like that. Yeah. And I require an insurance requirement policy. When they go get it, at this current time, it's generally about $300 for them to go get that, and they want to use the room for 4 hours. So, you know, it's about $100 worth of meeting room space, and then it's like, you know, I lose all those people just because of that.
Yeah.
If that makes sense.
yeah, but on the other side of that, what if you have one thing go wrong out there and then I mean.
Guess we could talk to Bentley and see what actually coverage we have without them doing that. That would be the thing to do.
And I don't know who drew this last contract up, and I don't know if it was Ian, it was probably way before Ian.
Yeah, probably. It's probably something that's been in our rule and regulation for a long time, I would assume. And I was gonna talk to some of the other fairgrounds about that particular issue, and I just haven't done it yet, because I wasn't thinking about it at the time, but, you know, I
So,
would-
let me ask you a question, Justin, to be fair, to look at all of these comparisons.
Okay.
We're paying out of the CTF funds, all of the wages except for 25% of yours. So how does that compare with their fees and compared to what they're paying for? Because we need to see that to have an actual real comparison. Because right now, we're using a lot of the CTF funds, which should be for capital improvements out there, and we're actually having to use it for payroll.
So,
So how does that compare? Because that's not up here.
no, but I believe CTF allows us to do operating as well as capital
I know what it allows us to do.
So-
I'm just saying comparable.
to
What
the
does
other.
Montrose use
to, like,
CTF
Montrose?
for wages?
Yeah, I don't
What
know.
does Mesa use for wages? What does La Plata use for wages?
Gotcha.
And what does San Juan County use for wages? Because to make a true comparison, we need to have all the data. So
Okay.
just to look at this screen, it's looking at just this side of the data, but what's the other side of the data? Because I get what you're saying. We want to have more income, but I would hope that at some point in time, we could be able to pay at least 50% of our own salaries from what we're bringing in. And right now, we're not doing that. We're not even close.
Okay.
CTF allows it, and that's why we're doing it. I get that, but on these comparables, so that's the other part of that coin that I'd like to know. What a part of CTF are being funded for
For all of theirs.
for all of their
And that
wages? Because that would be a fair comparison.
I don't know 100%. I do know, I don't think they're making anything for say, it's either their general fund just covering that, but it's something I can look into.
Yeah, would you just find out for sure? Because, and if we look through some of these look fine to me, but
Yeah, and it's hard when you're looking at it because nothing's apple to apple. I mean, when you look at like, just for instance, the Coliseum, when we charge us $750 a day and Montrose charges $1,000, they're adding things into their rental that we're not. So like they're saying, okay, we're giving you 2 guys for the whole time or things like that. So when you look at that, I tried to keep it as well as I could. But it is very hard to kind of get an apple because every facility does cater to individual events a little bit differently. Also, we do a booking fee on top of our rentals. So we're the only ones that do that. So like the Coliseum indoor would be $800 a day technically instead of $750 when you include that booking fee. I can do a little research into that side if you'd like, as far as what these places are getting their or using their CTF and or I guess how they're covering. I know none of them's making anything at the end of the day.
and again, we're not trying to make anything at the end of the day. We're trying to cover our fees at the end of the day.
But
So
I don't think their fees are covering all of their wages, I guess is what I could say, and operating, since they're kind of the same fees as we got.
so they're probably doing the same thing we are
Yeah.
using CTF. I just want to know
Something
what's
like
the
that, yeah.
balance.
Okay.
Because we're using everything but 25% of your salary is being covered by CTF. So what's that comparable is my question.
When did we raise these last time? How long has that been?
We did it in I think we started in 2019 and then we did it again because we did it in a 2 years. We did it over 2 years. It was 2019 and 2020, right?
I want to
Or
say,
20 and 21.
No. We did it since I've been in.
yeah,
Yeah.
we just did
Last
it.
time. What I was just getting at was,
I-
I think,
23?
because some of those
That
was
sounds
already
right.
pre-booked. Some of those was already pre-booked.
Yeah.
I think this is about the first year where we've actually had Where you were actually
Second
at
year,
totally,
technically,
because
yes.
some of those were already
Second year.
pre-booked.
So 24 and 25 would
Yeah,
be.
so all of 24 and all of 25 have been on that new
So
rate
would've been-
schedule.
Yeah,
Yeah.
that's a
The
new
year
rate.
prior, some of them
Yeah.
were, some of them weren't.
Yeah, some of them were,
Yeah.
some of them weren't.
And that's kind of helped me get a little bit of an idea, you know, just from last year, kind of where we're moving forward. But I do think that's in our best interest is just to try to have more out there to gain more revenue rather than, you know, pricing everybody out. Because that is a problem I am going to have. We are going to lose a lot of events, I believe, if we do start going too high. But that's our way, first reward, I guess.
So and I get and appreciate what you're saying too, but there's the other side of that coin too, that if you wait 5 years and then you have to make a 15% jump, that's even worse. Instead of taking 3% or 4% per year, I don't know what the number would be. It's a whole lot easier to budget just a few pennies instead of a big chunk.
And then one thing else to just kind of to keep in mind with our budget. So like we budgeted 80,000 last year for operating, but we're putting in over that. You know, we're bringing in 110 for our putting in the general fund. So if we were to increase our budget off a general fund, you know, that's going to increase what we could pull for wages too, you know, to move over instead of just running out of conservation trust. And if we do that, I don't know what the exact numbers would be. I don't know if it would be a 50-50 kind of deal like you're asking. But it would be a little bit more of a split.
I guess, I mean, in my mind, it would be better if we were closer to a 50-50 split. And I know we're not anywhere close to that right now. And we might not ever get that close to it. I don't know. I'm just saying what. But I also like the idea of getting more events out there and packing it up, which is the easiest way to gain revenue, is if you can pack it up.
Yeah, I mean,
But I don't-
obviously we're going to have more in expenditures, but I believe our
Right.
revenues are exceeding our expenditures in that case. But I can work on that a little bit if you guys want me to, as far as trying to see how other fairgrounds event centers are running their, you know.
I mean, just looking at what we have
Cost
in front of
revenues.
us right here, the stall rental, I don't have any issues with that. It's relatively comparable, 25. But say you just raised it 2% or 3%. So
if we go off of a 2% over the total year, we're going to have an extra $2,400. I mean, or so, because we're 110. So
right.
Yeah.
So but here again, it's a very minimal increase, but it is an increase of just what we're having to put out there. And would that really break anybody's bank? I'm just asking the question. Because then if you wait 5 years and you have to do it and it's, I don't know what it is.
you know, I see where you're saying with some of that, and some of these I don't know, like panels. I don't know if we want to up them, you know, like another $1, or you know, we get quite a bit of money off of panel rentals. You know, there's a lot.
And I'm not,
I didn't bring those in, but or RV hookups. You know, we get quite a bit off of that, but $1 on that would probably be fine. I get what you're saying.
thoughts, guys?
I think we need to really take a closer look. I mean, we may price ourselves out of the market, but we may underprice ourselves out of a fairgrounds.
One thing I'll add, just big picture here with these various fees. I'll have to do some homework, I guess, on you know, if there's special considerations that apply to our fairgrounds. It's not an enterprise, or is it an enterprise?
No.
No. Okay, I didn't think so. But you know, I think the most clear-cut, like, legal argument for raising fees would be if our expenses were going up in that area. Like if, you know, the people who make whatever some of these things are, if our labor costs are up or, materials costs are up, things like that, and the county needs to raise the fees to, cover our own costs, that's the clearest legal basis for raising fees in any method. And where you start to get on thinner ice basically is if you're looking to raise revenue, that can potentially get you into like Tabor violation land where, because Colorado has these very specific restrictions about raising revenue, the more you kind of get into the raising revenue framework, I think the
So
more
let me
risk there
rephrase
is
it.
on that issue.
It's not raising revenue, it's raising enough revenue to cover our costs.
Yeah.
Okay.
And that's what I'm saying is
Our fairgrounds-
CTF is paying all of the labor costs, 100% of the other two hands out there and 75% of Justin's right now. So that's what I was trying to say is, why can't we get somewhere closer to where CTF's only paying 50% of it? Because what if CTF goes away? Or what if it gets reduced again? And then we're gonna make a bigger jump, and I don't know if it is,
So I don't,
It's
I-
never
So-
been a revenue generator. I
It's-
mean,
no, and
we-
it's
we've
just
always
to be a-
supplemented it.
it's, right.
Okay.
which is also one of the reasons why I think CTF kind of helps out a lot of places that have something like that, public recreation, is because, how do you make money on it? I have not ever seen that funding go down as far as CTF goes. I know for 2025, they do have that number set at $14.06 per capita, which is up $1.27 from the previous year. So we will be getting a little bit more in 2025 from that.
We thought we were gonna have a bunch of severance tax money too.
Well, this is what they're reporting on their website, so, or that's where I got it.
Never,
I know.
Never trust 'em.
I get what you're saying, but it also isn't a tax, it's a proceed from the lottery funds. So I don't know if that plays a part in it.
what if they ultimately decide to change that to education rather than outdoor activities?
And I guess that, I got it.
That's
I
all I'm
got it.
saying is
That's
that
what it was supposed to go for to begin with.
That's exactly
When the
right.
lottery was passed, it was supposed to go to education.
education, and
They
they
took it away
moved
from
it.
that and put it to outdoor stuff and.
So I'm just, my question again, it's not to generate
No.
revenue, it's to generate enough revenue to cover
Our expenses.
the expenses. Because if it goes away, or if it even diminishes, I mean, everybody got a raise this year. So those costs obviously went up. So we're taking more out of CTF. And we're trying to do capital improvements with CTF like we always do. And we've done some good ones out there. But we have more slated to do.
We do. I just think maybe though, in the eyes of some of the public, it's a little bit more important for them to have a facility rather than to have, more going into some of the improvements. Some of them we need, obviously. But I do feel like the public would rather see a facility there rather than, if that kind of makes sense.
I understand that, but part of those, to keep the facility there, we have to keep up with what the state is passing for us to do with the ADA requirements. It's a huge ball that just continues to roll. I don't know. This is just a presentation. We're not making a decision
No, I
on
get
this
it.
today anyway.
But I can do that for you guys if you guys want some more numbers on what other fairgrounds are doing with their additional
Yeah,
funding,
just-
I guess.
just
to
find
kinda get an
out.
idea.
Because then that way we have a real picture of
Okay.
everything.
And then I can also kind of ask them about what they do as far as if they waive liabilities of some sorts. Because I
And
don't
I-
know if all of them require
Yeah, I
insurance
think
policies.
that's-
Ask Bentley.
I'm not, until we know what our insurance provider's gonna carry or not, I don't wanna. I don't want to make that decision. I think that would hang us out. Obviously, that was decided a long time ago, way before us.
So what do you look over here to sold for?
Okay, I'm looking over here.
Either way.
Well, okay. All right. Because I'm sure that they, I mean, it's been driven into me now for 6 years that limit all the liability that we possibly can limit, and that's from the insurance providers and the attorneys. Limit, take away the liabilities.
I got it. Just makes our life a little hard trying to, no, I get it.
You know, we got,
They get in trouble.
that sales tax revenue would have gone to the sheriff, would have freed up a little bit to make these improvements.
All
But
kinds of things,
They told
but-
us no, and we are sticking by that.
And then, you know, I see it. And then the people that do visit our fairgrounds, you know, we're not getting nothing off of them either. You know, how do we
No.
gain anything, you know, unless a sales tax helps the county some way or somehow. Two things to keep in mind with this, we do run 2 events out there that we don't get any money from. One is the fair, obviously, that takes away 2 weekends from me. And then sometimes it makes the third one kind of difficult to do anything big. And then the Ute Mountain Rodeo, although all theirs goes back into the facility, you know, we don't see actual monies from that, it is credit. So, you know, that's something to keep in mind. Those are my 2 biggest events, 2 biggest money makers, and we don't see anything from that. So, I don't know how we account for that either, I guess, you know, how do we say the
Well,
fairgrounds?
I mean, the U-Mountain, I mean, they put in a lot of pretty big improvements out there.
They have, and
I
it's
mean-
helped the fairgrounds, you know, tremendously. You know, and
So I don't know how you quantify that either, but I think they've contributed plenty, or at least for 1 weekend a year. I think they're doing a damn good job of
Correct.
what they're doing to the fairgrounds.
Correct. And what they cover, you know, as far as what they've put in, you know, it's about $24,000 worth a year. You know, that's what their event costs. So now that our prices are increased. So, you know, you just kind of put that into comparison, you know, they always try to cover that in improvements. So that's where we're at. And the fair, you know, obviously, you know, it's the county fair. So what do you do? But,
Yeah.
you know,
Okay.
okay.
Yeah, just, that's the only real question I have, is just what are they using their CTF, and how much of the payroll are they covering with it?
Okay.
Because that's the biggest factor. And again, if we could just get 50%
Okay.
coverage, you know, of the, you know, would be, I think would be a good place to shoot for,
Okay.
because right now we're not anywhere close to that.
Let me try to look at that then. Try
Okay.
to go for 50%, and I'll get some answers on that and get with Travis as soon as I can.
And again, I don't want to raise it significantly. I'd rather raise it a little every year than just all of a sudden sit for 5 years and then we got to raise it a bunch, so,
Okay.
okay. All right,
All right. Thank you, guys.
thank you, sir. All right. Next up, Don. Planning. I think we've already talked about most of these for you, so this should be pretty quick.
Right, yeah, we covered, well, items 1 and 2 were already a done deal. I'm on the first variant section.
Yep.
And talking more over with Stephen this morning, I'm not sure we can even discuss the fee schedule based on information he's got, or maybe he's got something more he found out today. I tried to explain to him that these fees aren't based on like an application fee where it's like, do you spend 2 hours, 5 hours, 9 hours working with the application? It's strictly a permit for a business to operate on an annual basis per unit. So we've got, as you know, you were here in 2019, we presented that All short-term rentals should be permitted, tracked. Lodgers' fees have to be paid to the state. At this point, we have no idea, no way of knowing, no way to track them. We don't even have an educated guess on how many are out there, short-term, long-term.
You know,
House
how
Bill
does the ci- how does the
1247,
city-
what's that?
How do the munis keep track of their short-term rentals?
They
You know?
charge a fee. At the last meeting that we had in Dolores, when we had our
Yeah.
tri-county meeting,
Yeah,
Mancus said they were charging $7.50. Am I correct?
I think that's what you said.
and Dolores was
And
five.
Dolores was,
See, and Dolores is trying to put a moratorium on, so they're
Right.
tracking theirs to hit some limit or some goal or some
yeah, they
restriction.
limited theirs, I think, to a dozen.
Yeah, I don't know if Mancus has a limit on theirs or not. But I don't know how Cortez tracks, I can't remember.
Yes, so I guess to back up a little bit, what Don was saying earlier, Don let me know basically that, we were gonna talk about this earlier this morning. I started looking into it a little bit. My question to Don was, what are we doing with this process? And it sounded like it had come before the board a few years ago, and the board decided not to implement this kind of permit process. And so it is something that the board has the power to do in statute, is to permit and regulate these short-term rentals. It's not mandatory, right? And previously the board decided they didn't want to basically be in the business of doing that. And I haven't watched the video, but I heard, there was some discussion about private property rights, and at the time, the board decided that's not something they want to get into. There's this issue, as I understand it, with essentially, I guess I would call it taxes that should be paid through this lodging tax to the state, which eventually would come back to the counties, that it's not clear to me. I think it is clear to me that we're not the tax collector of this tax. The state is, but we have no idea, based on my conversation with Don, is this being collected in an organized way? It's sort of a black box, as I understood Don telling it to me. And there's a concern that there's money that's not being collected, that should be collected, because there's not a good oversight mechanism for this. It sounds like, from what I'm told, that some of these bigger companies that list these short-term rentals, they have a mechanism for collecting these taxes, but maybe not all of them do. I haven't had an opportunity to look into it myself. So that's one of our concerns. Sounds like just, hey, this is tax revenue that the county should be collecting that's potentially not being collected. And there's also concerns about basically conformance with our normal development requirements that are not necessarily specific to short-term rentals, but just in terms of development, about getting a septic permit, that there's a concern that these short-term rentals are being built out in the county. They're not going through any kind of land use planning process. They're potentially not getting a septic permit, and then they're being listed as short-term rentals. And so I think there's kind of a bigger question: what does the county want to be doing as it relates to controlling short-term rentals? Is this something the county wants to, develop a process for? Just in looking into this briefly, since my conversation with Don, looks like a lot of counties formalize this process by adopting an ordinance, having provisions specific to rules about short-term rentals, often included in their land use code. And then, in the short amount of time that I've spent looking at this, these permits and the permit fees are related to basically monitoring these applications and controlling the proliferation, I guess, of these short-term rental applications. So I think we have a big picture question is this something the planning department should be spending more time fleshing out and putting some kind of proposal together to do regulation in this way? Or is it still the county's position that, this isn't really something we want to get involved with?
So now you're asking me to go back to my memory because I was part of that conversation in 2019. And I don't think we realized at that day, and I don't know what it's moved from 2019 to now, but how many there actually were out there. And we didn't feel like there were that many. However, we've done a lot more research. I know I have, and there's a lot of them in the county. So, one, that's a concern, and then two, we weren't getting any of that income. And I remember going to Dolores and Mancus and taking a beating over the tax that we do collect of the lodger's tax because there wasn't enough in there to help fund the programs that we were doing. We then found that out. We created that resolution to send to the state, and I think Commissioner Lindsay, you and I were on at that time. And then we started getting that tax back to the lodger's tax, and then that grew significantly. Now, the other question now is that there are a lot of these things that are cropping up, and they're not being, I don't think they're being
There's no
joined with
oversight of
septic
any
systems.
kind.
There's no
They
oversight.
just people are
I
doing
think we're
it.
just getting them kind of spread out there into a different fashion and manner than the conversation that we had in 2019. Because I want to say I probably voted against it in 2019. Things have changed since then, and it's Airbnbs, VRBOs, it's
Well,
way
ever
bigger.
since COVID, it exploded.
Yeah, so,
50% of our phone calls, people are looking to buy property to do short-term rentals.
now, as far as limiting it, I don't think, like, in a municipality, like I know Dolores does, I don't know if Cortez does or Mancus does, but that would be a conversation down the road later, I think, but I definitely think we should have some kind of oversight. And if you look at what it takes to do just an ATF and the fee that we just put on that, I would assume that it's gonna take at least that much time to take care of a short-term rental.
So what's happening now is we are getting complaints because of traffic issues, because of short-term rentals, because it's not just 2 cars there. They go to work, they come home, it's 4 or 5 cars, 6 cars, 7 cars. It changes every 2 or 3 days. Some of these are access easements. People are wanting to now know if they can lock the gate because now it's a business. It's no longer just a guest house for family. It's only getting worse. It's not going to get better. And that was my position in 2019, before COVID, before anything else, that we have no control over it. And we've had this discussion 50 times. Mine is not that it's a commercial property because they're renting, but we've had it where, at least the previous attorney, that if they're renting a house, it's a commercial operation. Well, everybody's renting something now in our county, all over the place.
Yeah.
And we have no way to track it, no way to oversee it.
Does the assessor's office not track that? And
Not-
how's that land being taxed at that?
It's taxed as residential.
Yeah.
It's
That's
residential.
that was another argument that the state has had too, because it's a commercial operation. So,
Yeah, there's a, I think it's
State's
2015.
allowed to do that.
exactly, so the assessor's stuck with just taxing them at whatever it is,
Yeah.
which is fine, that's a state decision, we don't have, we can't,
No, it's not fine.
well, it's not fine, but we don't have a choice in it, we've fought it as hard as we can. But I think where Don's at now is that, look, we've got to start doing something within our own county, because if these, like I said, the last time I looked and I did it with you, was on Air DNA, and there were over 240 in this county at that time. If you look at motels, 80-room motels, that's 3 motels. And there's probably more than that right now. And like you said, at COVID, it blew up, and I'm not
And
taking anything away from the person doing it, that's fine, but it is a commercial operation, and if they're just hooking them into septic systems that currently exist, we're gonna run into other issues, I think. So, that's just,
And are the restrictions, like Dolores restricting their counts to what, a dozen? Is it forcing it out into the county?
I think it was 10, they changed it because they didn't have any LTRs there. So all the two-time property owners are keeping it because they're making a lot more money than the LTRs and the people that are trying to live and work there don't
Yeah,
have
the
a place to
people
even
that-
rent.
That need to live there like the mayor and can't.
Now, this goes back to
Can't be
affordable
mayor.
housing.
Yeah,
This goes
They
right
have
back
no-
to affordable housing.
The only other thing we had brought up in 2019 that is if you were doing this, besides having to be permitted, is you had to be a resident of Montezuma County so that we could intercept the large corporations coming in and just renting them all out and buying up all the properties.
I think that's what Mancus does as well, something similar.
So that, I mean, I don't
There-
know that, well, I mean, it's up to you guys, but we've got to have them in our system. And it'd be an annual permit and it's per unit.
I know that a lot of other counties are doing it for the same reason. Specifically, I'll talk about Summit County because they're having the same issues that Dolores is having. They don't have enough people that can live in the county. Of course, it's a very high dollar county to live in, number one.
Your Rays
And
have
so
the
is-
same problem.
Yeah, they're all, I don't know,
And this isn't because it's going to be easy.
no, it's not gonna be
This is
easy.
not something that, because we're bored. But we needed to have done it in 2019, so we weren't behind the 8 ball, and now it's a big black hole. And now Senate Bill, 1247 says you can triple your lodger's tax fees. Well, we can't triple anything over anybody because we have no idea.
Yeah.
We don't have half a starting point. And I have talked to people that have called and asked about it, and they've already done their application to the state. But I guarantee you HIP Camp's not doing anything.
No.
So legally, could you put a yearly fee on this, on these?
Yes. If it's related to the county administering its, system of permitting these applications and ensuring they're related to the county's cost of administering this program. What I think would be not supported in the laws if we just said, hey, everybody who makes a short-term rental, send your checks to Don, and that's it. It's got to be related to the program and the administration of this process that we're
And
trying to
that's
do.
why, if you look at the variance fee and the ATF fee, those are kind of wild numbers, but those were actual true costs of what it was costing them to administer. That's why you get a 348 and a 696 for the fees, because that's what it's taking to administer that. They're not just an arbitrary number. There was actually math put behind the numbers.
Yeah.
So I think what you're saying, Stephen, is the same thing, is like, what is it gonna cost to administer it? And that's where you create the fee. It's not just like Mancus's, maybe theirs is 750,
I
but
think
they're
it is.
also a little bit different because they're a municipality, but
Yeah. So for us today, I think this is the start of a longer process by the planning department to, come up with what are we trying to accomplish by regulating short-term rentals. ultimately, this would probably come back to the board as some kind of proposed ordinance potentially, and potentially amendments to the land use code to outline what the board would ask the planning department to do as it relates to these short-term rentals. And then ultimately, the work that the planning department does would trigger some kind of fee being assessed for these kinds of uses out in the county so that that program can be administered. That's how I'm thinking about it.
So my question to that too, because then you would also have a RIP, a road impact fee, or RIF, right? Because it just like,
It has to be a legal residence, road impact fee,
to be
septic
a-
system, driveway permit,
and I
if
guess
there is a
that's what I'm saying,
secondary.
because just like those that are down there by you, how many are down there right now?
We created a 5-lot deal right there.
I think,
So
yeah.
they're all,
And we had to bring that in and after the fact because they didn't
Yeah.
contact us for
because
anything.
we
and
didn't
they
have anything, and that's what I'm
Septic was
saying
on
is that,
somebody else's
we're not-
property.
I can guarantee, I can show you another 10 of them around the county.
and they're, I think now
May
it's
not have
getting,
5, but they've got,
it's getting
3 or
out of
4.
control.
Everybody's doing it.
2019 was a totally different conversation than after COVID. So I don't think the number would be 750. I think it's gonna be, I mean, we could again do the math. It's gonna be what it's gonna be.
Well,
But it
there's
would
no,
be
there's no
relative
way
and
to do the math
justifiable.
on how you're gonna figure this
know.
out and who's gonna get paid for 6 months of research so that you can finally have a 40-person list. It's just gonna have to be a fee of what it's gonna be a fee of. To, start, find out, create the database, go through it. We can integrate it into our software system we've got now for permits. But that's gonna have to be, well, probably would just convert it in-house as a way to, permit these every year.
So right now, the proposal is the STR would be a 978 per unit, and that was derived from the land use code fees for the non-residential lodging in per room,
Correct.
per unit.
And, yeah, and that's something that was in our land use code, fee schedule. I guess my thought is that this is something that's gonna take a while to develop, and I think one of the considerations would be like on what kind of a time scale or is the board wanting to see this implemented? Because we know this is going on out in the county now. But it might, I mean, I guess from what I've looked at so far from other counties, there's often like a ramp up period of, 2 years to get into compliance and share your information. If the board is interested in thinking about that, it could be quite a long process, I guess is what I'm trying to say, before we start doing anything on that. If there's land use code amendments that are done.
I would recommend that it not be in the land use code.
It's just basically gonna be
Depends on how much you want to
STR.
get into a whole bunch of wording that still isn't going to fit for what everybody does.
Yeah.
It's going to have to be gray area that you can manipulate because everybody takes a hay barn, turns it into an apartment. They take an old cellar, people are living in grain silos. You would be amazed to see what they start converting everything to.
I know we did one in Mancus for a wagon and a
Oh, yeah, but
bin and a,
that was
What
done
else
the
was
right
there?
way.
no,
That
I
was
know,
done
but
ahead
I'm
of
just
time.
saying, it was a grain bin, a wagon, and what was the other one?
no, I forget now what it was.
So it's, yeah, I mean, it's not, I would agree with Don on that too. I don't think you can make it anything that's, I mean, people are wanting to stay, like you said, at hip camp. They're staying in teepees and,
Did you see what they, I shouldn't say.
so I don't think it needs to be a long process.
Okay.
That's just my
I
opinion.
don't either. I'm sure he's way he's smiling there, he's probably got some pretty good ideas.
Well, and I was part of the conversation in 2019, and at that point in time, it didn't seem like it was that big of a deal, but things have drastically changed since 2020, and we've actually seen it up here with just what we've had to do in the last couple of years. So I don't see charging the fee for the annual permit specifically to make sure that they're hooked up properly, and/or they have facilities. If they're just in a wagon, they're not gonna have a facility in there, but where the facility, I mean, those are my
Yeah.
thoughts.
So maybe next steps, we'll get together and sort of articulate what that process would look like and maybe put together a draft ordinance for this type of permit that the county could then administer.
Well, obviously, some of these other counties are doing this.
Oh, a lot of other counties are doing it,
Yeah.
They're
so
all
we
over
ought to
the
be able
board.
yeah.
Yeah.
They're all over.
And
They're
simple
all-
math, if you implement it June 1st, we just cut the prices in half for 2025.
Correct.
Full price for 2026.
Or you could just do it on a, yeah. You could do it
I
on
know.
So a lot
The
of,
point is that
yeah.
it is out on the website that we don't charge for short-term rentals, and we're just getting bombarded.
I know.
So, yeah, another aspect to this too, what I've seen from other counties is a lot of the kind of in similar to how when the county issues a high impact permit, there is kind of an ongoing obligation to abide by the criteria. And if you violate the criteria, you can come back in front of the board. Similar arrangement, what a lot of other counties do is they have some kind of mechanism to rescind the permit if there are a lot of complaints about traffic or noise or, things that are causing problems in the community, that's part of what the permitting process is supposed to accomplish, is to, let people use their property in a constructive way, but if it is causing problems, there's like a clear mechanism to make that problematic use discontinue according to some kind of, fair process is part of what I've seen from the things I've looked at so far.
Right, because right now, if we have a complaint, or you have a complaint, there's nothing that we can't do it. We can't touch it.
It's just an
Just a complaint.
ADU, and a lot of people are driving there.
Mm-hmm.
But it's a commercial ADU.
But it's being taxed as
Yeah.
residence, which I agree.
Yeah.
Or you zone everything commercial, and we'll do away with most of the land use code except subdividing.
So on that issue about the commercial and residential zoning, there is a 2015 case out of Conejos County that I was looking at after my conversation with Don, where in that case, this is the question basically, but in that case, the assessor, I think, designated the property residential when they were doing short-term rentals, and it was upheld on appeal basically. So the way I would just explain that is it's not wrong to have it zoned residential if you're doing short-term rentals, basically.
Correct, and I know that's what the state is doing.
That's the state of
However, it's
Colorado's
not
opinion, though,
Yeah,
not mine.
because it is a commercial
Well, it's
undertaking.
strictly commercial, so getting your
You know
annual
what- you know
permit
what
to operate your
ticks you off
business.
about that right there? I can have a hay barn down there on my farm, and it's commercial. It's commercial. All my buildings down there get taxed commercial rate. Just the ground is ag. And that's screwy. They can do a commercial dam operation. I'm not using it commercially. All I do is put my hay in it so that it don't get rained on. That's the only damn thing that it's used for. I don't sell hay out of it. I don't do any of that
There's
stuff.
been a lot of conversations
It's
with the state
Bunch of
for
crap,
that because
that's
of
what
the
it is.
SCRs.
For them to exempt these solar systems and this kind of deal from being what it is, taxing what it should be taxed at. It's a bunch of crap.
So is that, I mean, I don't think it needs to take 2 years
No.
or a ramp-up process. I mean, we've been now dealing with this. Well,
If it takes 2 years, we're on year 6.
I know this
Yeah.
board has been dealing with it specifically just from the stuff that's come in front of us. I will almost, well, I won't say that right now.
And I have been in contact with Brian Bartlett, who is in charge of the Lodgers Tax Committee, president, or I don't know. There's
He's the
only
board-
2 of them, I
board
think.
chair, yeah.
But I've got some projections from him on what he would guess our county is missing. And it's not a little bit.
It's a lot of it.
Specifically since COVID,
Yeah.
it's increased dramatically. Okay, I think we'll look at
Yeah.
it a little farther and more in depth and make it happen. Is that-
Yeah, I'll get together with Don here and we'll kind of try to articulate what exactly it is the planning department would be looking to accomplish on that kind of an issue and maybe come up with a draft ordinance about how this process is going to work to bring back at a later time.
Okay,
That
All
works
right.
for me.
sounds good. Any other questions for him?
No.
All right,
We'll also pick up some road impact fees from it, once we start finding all of these places out.
Yeah.
And that'll also pick up other units for the assessor's office.
yep. Correct.
So, I know that they do assess commercial around certain parts of properties, and then the rest is ag. Is that an option? A
I don't-
fine line to thread between
I
the
don't
state
know
not letting
how-
us have anything?
I'd need to
The
do additional research on that.
statute for her of how she has to assess the different properties, I don't
Right.
have any idea.
Because, yeah, I've seen them do ag land, and they say, well, we'll allocate 1 acre with the house and
Yeah.
barn or whatever.
Well, she does do 3 acres as far as residential around the house.
And then the rest is ag.
taxed as ag.
Yeah.
So just,
But all those outbuildings, I'm serious, I get taxed commercial rate.
so all
all
the
those
short-term rental
outbuildings.
buildings would be
And why in
a
the hell-
commercial rate?
Yeah.
And then you're still meeting the state at its ag land.
Yeah,
They are.
I'm gonna leave that up to the attorney.
Yeah, that's probably honestly something to talk to the assessor about how that works at a very practical level.
Just like these solar.
I don't know
getting ag
I don't know
taxes
how
and
much
that.
has to be in an
These
ordinance.
guys are
I don't do ordinance.
Well, I'll work with you on that.
Well,
Perfect.
There wasn't that many of them, they've gone crazy. They've got over there in Acatomagus, there, all over the place.
Okay, are we good?
Yeah.
We'll move forward.
Perfect.
Okay, and then we'll actually come up with a number we feel is real math justifiable to whatever it is. Okay. And we'll ask, but I know Mancus was 750. I want to say Dolores was more than that.
Oh, we can find
And
out.
Cortez was the cheapest one. But we'll find out tonight. Okay.
All right, fair enough. Thank you.
Thank you, Don. Appreciate it. All right, with that, nothing else is on our agenda, gentlemen, so we are adjourned. Thank you all for coming.